Let's talk about the clinical manifestations of ADHD in adults. So, how does it show up in adults? While many people associate ADHD with children, it's essential to recognize that adults can also be affected by this condition, even though the symptoms might be different, right? This is many people who had ADHD as children. Some symptoms go away, some symptoms persist. There's this confusion about whether some people only have this late onset, adult onset ADHD. So in adults, ADHD manifests with a variety of symptoms. Key things: executive dysfunction, inattention, impulsivity, restlessness, and emotional dysregulation. So these symptoms collectively contribute to significant problems in functioning, making various aspects of life very difficult. Executive dysfunction. This is a hallmark feature of adult ADHD. And what does this mean? So this is trouble with memory, with shifting from task to task, with self-monitoring, with initiation of tasks, and with self-inhibition. So these deficits make it challenging for individuals to remain focused on tasks, organized, difficult to prioritize, difficult to follow through and complete tasks, a lot of forgetfulness, poor time management, and of course that will have a big impact on someone's life. Inattention symptoms in adults manifest as difficulties in remaining focused on a task, especially tedious or boring tasks, difficulties with organizing activities, with prioritizing tasks, with following through with completing tasks. And individuals may report finishing tasks only if there's a deadline, if at all, and may have problems related to driving, such as driving errors or traffic tickets, speeding. Impulsivity in adult ADHD. So this is characterized by engaging in activities or speech with high potential for negative consequences. So, for example, prematurely terminating relationships, quitting jobs without really having a plan. Impulsivity can contribute to many negative outcomes, again, with driving, but also lots of relationship and career problems. Unlike the hyperactivity that is commonly seen in children with ADHD, adults with ADHD often report feeling fidgety or this inner restlessness rather than really looking hyper or moving around a lot. And they may also engage in excessive talking, where they might be interrupting others. Emotional dysregulation. So this is another common feature of adult ADHD. This involves mood lability, so mood up and down, irritability and crankiness, anger outbursts, and low frustration tolerance, right? So it's hard to stay level, right? And also trouble with motivation. So these emotional symptoms, while they are not specific to only ADHD, they significantly impact people's ability to function in daily life and in relationships. Adults with ADHD often experience a whole range of impairments and health and social problems. They have trouble at work, childhood impairments, educational difficulties as children, problems with self-esteem, which started in childhood and may persist into adulthood. In work areas, adults with ADHD may face a high level of unemployment or impairment with work or trouble with staying productive and also work injuries. And they may have trouble with achieving their full educational potential that may start early on, especially with undiagnosed, untreated ADHD. And of course, it will affect educational progress over time. Individuals with ADHD have been found to have higher mortality rates compared to those without ADHD. The top cause is accidents, but even among individuals without common comorbidities of ADHD, there's still excess mortality. So this is a very significant condition. It can increase risk for death, right? So it's important to catch it, to diagnose, to treat it, to get help. So overall, ADHD presents differently in adults than in children. I just described the typical presentation, and recognizing these manifestations and their huge impact is essential for diagnosis, identification, and then getting help, effective management of the condition to protect people from the negative impact that ADHD can have on their lives. So there's hope. There are lots of treatments. I hope this was helpful.